It's a very interesting question. I'm come sort of from the old school. It's interesting listening to the concept of acquired resistance as this was some new concept. Acquired resistance has been going on for quite some time. Chemotherapy is acquired resistance. They respond and they progress. What's unique, I think, for the targeted therapy is we don't mind continuing it because they're not suffering with the toxicity. There's no, they don't have the hair loss, they don't have the nausea, the blood count problem, the risk of infection, fatigue, etc. So it opens up a different thought process, I think. This concept that, well, maybe some of the cells are still sensitive to it, and so then we just add something to it to combat that. Again, I think you can make the same comment with chemotherapy. I bet some of the cells are responding or it would grow faster. But now to answer your question, as you can imagine, what I do is I use the targeted agent for as long as reasonably possible, and I go a little bit longer than I would with chemo. So if someone had basically 90% of their disease was controlled, but you had a spot that got a little bit bigger, I might ignore the spot and treat them, or I might think of a stereotactic approach to the spot. Probably wouldn't do surgery in a metastatic setting. Certainly if it was brain, and this happens with crizotinib quite frequently, that where disease controlled below the neck, progression in the brain, stop the drug, radiate, and restart the drug. So I go that particular route. If it's diffuse disease, but very slowly progressing, and they're asymptomatic and they're tolerating therapy well, I'll wait another couple of months or so until they really prove to me that, you know what, this just, it isn't working and things are starting to grow, etc. I then stop the agent and move on to something else. I'm not quite as convinced. I understand the concept of flare, and I suspect I've had a patient or two that probably has suffered that way. So what I try and do is restart or start whatever second, third line, whatever subsequent therapy in a reasonable time. I don't necessarily give them a 2 to 4 week holiday. I'll try and get things mobilized and get going.